In this video, we will discuss how to read a coronary angiography. There are 5 important views to visualize the coronary arteries and its branches. There are 2 views for the right and 3 for the left. RAO or right anterior oblique view or for the left coronary artery. LAO or the left anterior oblique view is for the right coronary artery. Easy to remember is that the views and the arteries are opposite. That is, right anterior oblique view is for the left coronary artery and left anterior oblique view is for the right coronary artery. This holds true but for one special view for the left coronary artery that I will mention in a while. These are not hard and fast rules, but it applies for most of the times. So the 2 views for the right coronary artery are iliaco-caudal and iliaco-cranial. The 3 views for the left coronary artery are arterio-caudal, arterio-cranial, and the third view, which doesn't follow this opposite side rule which I mentioned before, is iliaco-steep caudal. It is also called the spider view. Before proceeding further, there are some concepts to be remembered. In chest X-ray, the views are termed as according to the direction of the X-ray beam enters the body. If the X-ray beam enters the back of the body, it is called PA view. Here the X-ray cassette with the film is kept in front of the chest. Similarly, in AP view or anteroposterior view, the X-ray beam enters in front of the chest and exit the back to reach the X-ray cassette kept at the back of the chest. In coronary angiogram, the labeling is totally opposite. In the CM machine, this is the X-ray source and this is the image intensifier, which acts like the film in chest X-ray machine. In coronary angiography, the views are not labeled as per the direction of entry of the X-ray. Here it is labeled according to the position of the image intensifier to the body. In LAO view, the image intensifier is turned to the left side of the chest, and in RAO, it is turned towards the right side of the chest. In cranial view, the image intensifier is tilted towards the head end of the patient, and in caudal view, it is tilted towards the foot end of the patient. Caudal view shows the proximal part of the coronary artery, and cranial view shows the distal part of the coronary arteries better. Remember, here also it is the opposite terms. Caudal views are better for proximal arteries and cranial views are better to visualize distal part of the coronary arteries. Next comes how to find the views from the coronary angio videos. In LAO, the spine and catheter are to the opposite side, that is right side of the image. Other way is to see the ribs. If it is directed towards the left side of the film, it is LAO. And if you can hold the catheter tip with the left hand, it is LAO. Same happens for the right anterior oblique. If the spine and catheter are on the left side of the image, it is RAO view. If the ribs are directed towards the right side of the film, it is RAO view. And if you could hold the tip of the catheter with your right hand, it is RAO view. For cranial view, the diaphragmatic shadow is seen, and in the caudal view, the diaphragmatic shadow is not seen. But sometimes you can see the part of diaphragm in the caudal views. Let's first see the iliaco-caudal view for right coronary artery. If you remember, I told caudal views shows the proximal arteries better. So in iliaco-caudal view, the proximal and mid part of RCA is seen. One can also see its acute marginal branches. In elevocranial view, the distal RCA with PDA, that is posterior descending artery, and PLV, that is posterolateral ventricular branches, are seen good. PDA is the first branch to arise from the distal RCA, and PDA also gives rise to the septal branches. Let's see now the left coronary artery. In arteriocaudal view, the proximal part of left circumflex with its OM branches are seen. Here the LCX is below the LAD. The proximal LAD is also seen in this view. In this view, you can see how the LAD and diagonals are overlapping. In arterocranial view, the mid and distal LAD is nicely seen. Distal part of LCX and its branches are also seen. Here one can separate the septal branches from diagonals of the LAD. A levo steep caudal or the spider view is for the left main and its bifurcation. It is called spider view as the branching resembles spider legs. Proximal LAD goes straight up the roof. From left to right, you can see the 5 main vessels. Namely, first is septal, next comes LAD, next is diagonal, next is ramus if present, next is obtuse marginal, and last is the left circumflex artery. We will complete the video here. Hope it was useful. See you soon in the next video.